Chiropractic care can help with numerous problems, and Dr. Craig Livesay has numerous patients that can testify to that fact. He joins us this morning along with another of those satisfied patients, Shuly Cawood. Thank you for being here today, both of you. She had a very unique story. She was telling me about this earlier. It had to do with her little finger. Tell us about it.
We get a lot of patients that come in that have these little neurological, I shouldn't say little, for most people they're pretty good sized neurological issues when it comes to pressure in the neck or pressure in the low spine. In Shuly's case, she was having some numbness and tingling in her pinky finger.
Right, and it was increasing. That was the thing that bothered me. You know, it would happen like once a day, and then a few days later it'd be, you know, it started increasing more times a day for longer periods of time. And I started to get really worried, you know, and then you start Googling, which is always a bad idea.
Yeah, you start self-diagnosing.
Exactly, exactly.
And you were concerned there may be something else wrong, but you were also, you went to a physical therapist, and that led you to Dr. Livesay as well.
Right, right. So I was trying different approaches to try to solve the problem, and was told that possibly it was my neck, that there was tightness in my neck. You know, the thing that I don't think about is I do look down on my phone a lot.
Right.
And so
I think we all do. We're kind of like, you know.
And so that can bother your neck. So I was told, you know, lift it up. But the person said, well, maybe it's your neck. So I thought, well, I'd seen a chiropractor in the past. I lived in another location before and had loved my chiropractor there. And so I thought, well, I'll go see a chiropractor again. And so I asked for a lot of recommendations and was able to find him.
And you had to use like a different combination on her.
Yeah, you know, we're always here, we're talking about the Pro Adjuster.
And it's great.
And this is what we do with probably 85% to 90% of the patients. And Shuly's case was a little bit different. We use the Pro Adjuster on her, but we also use a mixture of the old manual style. And for her, in her case, this seems to be what works best for her, is a mixture of the Pro Adjuster and the manual adjusting. So we're not locked into one way. I always tell patients when you come into the office, you see we still have the manual tables there. There's a time and a place for them, and we don't want to get locked into that one-track mind thinking. And
you sit down and you discuss all this. You find out all the information you can and customize that treatment plan.
Yeah, everybody's not the same. That's where every case is unique and different, and then when you can start, and that's sort of the art of everything. You still have to, you can use technology, but you still have to have that intuition there that's going to tell you where to go and what to do, and just to see her smile and be happy, that's the biggest thing that matters.
And you're a writer, so having the use of your little fingers very important.
True, very, very important, and I use them a lot of the day. So my hands
and the tingling and everything's gone away.
You know, it's gone away, and I go back and see. You know, I go for maintenance to make sure it doesn't come back. But yes, it's been gone for months.
And we know that how gentle and effective this is, but he was also very gentle in everything he did with your neck as well as the manual as well.
Yeah, I love it. So I love it. I always feel better walking out of the office. You can't ask for a better recommendation for someone to say they love what you do.
Yeah, and even with the manual adjusting, it doesn't have to be violent.
Right.
You know, the idea of, I think people have seen the old Asian or Chinese movies where the kung fu and they're snapping someone's neck. It doesn't have to be like that.
Right.
It's a very gentle, just impulse. You know, much similar to this. We're just doing it at a different angle, and you can get that bone to move.
But we want to mention this
we want to mention it because we're getting close.
All right, we got Samaritan's Purse, the Operation Christmas Child, and you're doing a very special deal this year. You've got a goal in mind as well.
Yes, last year I think we did about 275 boxes.
That's great
for Christmas. We want to break 300 this year, and so from now till Christmas, I think my office manager told me we have 7 weeks to turn these in. So it's getting close.
I mean, that's
I was like, wait, it's
7 weeks.
It's 7 weeks till these boxes have to be turned in. So. Every new patient that comes in is $39.
Right.
But you don't have to bring a box. You bring
It'd be nice.
It would be great. It would take a little less work off of my staff, but we will go fill the boxes. So every patient from now till Christmas that comes in for that $39 exam, X-ray, and consultation, we're going to take that and fill one of these boxes.
That's great. Good job.
Yeah.
All right. And Shuly, congratulations.
Thank you.
I know. You know, sometimes when you get things wrong with your hands, it just seems like it affects your whole body. And to get the treatment you need is so very important.
It is.
All right. Thank you all for being here today.
Thank you.
It is Livesay Chiropractic. They're at 306 Sunset Drive, right above the mall here in Johnson City.
The preceding portion of Daytime was sponsored by